Hello, everyone. This is Dr. Mike Chu, a physical therapist. And yes, we are going to be, I'm your alternative healthcare career coach. Tonight, we're going to be interviewing Dr. Brett Levine on how to break out of that medical mindset. We'll be back in a few seconds, okay?
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
Good evening, my Facebook friends, YouTube friends, and all the friends around the world. What is going on? If you're watching live, comment live. Watching in the replay, comment replay. Well, anyway, I want to share this thing here.
Premium beat.
Well, I guess it's not focusing. I turned off the autofocus, but I want to share this today. It says here, quit sharing your dreams with people who are sleeping on you. Quit sharing your dreams. A lot of people, we're like sharing our dreams, our plans, and then they're not happy with those plans for you. So
.com.
make sure when you're sharing your dreams, you share to the people who will celebrate with you, okay? All right, but before I keep on going, let me just show this real thing here. If you need continuing education units, check it out, medbridgeeducation.com. Use the code alternative. You get 40% discount. Not just 10, not just 20, but not just 30, but 40% discount, right? Check it out. So good. I've been getting I need CEU classes. I teach CEU classes too. I have to buy my own CEU classes too. So I get the medbridgeeducation.com. Check it out. And of course, our sponsored ads, hellonote.com. If you need documentation system in your outpatient clinic, physical therapy clinic, check it out, hellonote.com. Of course, our guest for tonight is not a physical therapist. She's actually a surgeon. He is an ear, nose, and throat surgeon. For 27 years, he doesn't look like that old. He looks like 27 years old. And he is the CEO of Beach Cities ENTs outside of Los Angeles, California. LA, California, right? So over several decades, he faced many obstacles and challenges to remain happy and healthy in medicine. So right now, he writes free newsletter. So you got to subscribe to his website. It's called Breaking Out of the Medical Mindset. You know what? We've been talking about this. I interview different people, nurses, therapists, whoever, whatever. I interview physicians too. And this gentleman here, Dr. Brett Levine, he reached out to me. Hey, I watched this video. I watched this thing. I was tagged, blah, 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 blah. And this is what I do. Breaking out of the medical mindset. And guess what? Duh. It's the same thing, alternative healthcare career group, right? You'd think physicians don't get burnout, right? But they do, ladies and gentlemen. So in his group, the Breaking Out of Medical Mindset is a platform that they deliver breakthrough concept and strategies to healthcare professionals like us, right? To break free from suffocation, depletion, and burnout, to expand their options and to be empowered and achieve freedom, both financial and physical and whatever freedom he's talking about. So he also offered courses. This is what we do too in our group. We offer courses and to teach the concept and strategies and offer tools and resources for success, freedom, and happiness. And without further ado, let's go ahead and bring in Dr. Brett Levine. I hope I'm pronouncing your name right, Dr. Brett. Appreciate you, sir. Dr. Brett, could you please tell us again who you are, what do you do, and how can we get out and break out of this medical mindset, sir?
This is such a fun podcast. I can't even believe it. You are very cool, Mike, and you make it very engaging and entertaining. My name is Brett Levine. I'm an ear, nose, and throat surgeon for the past 27, almost 30 years. Also, on the side, I do real estate investing. And my real passion, like most people in medicine, is learning and teaching. And like a lot of people in healthcare today, it's challenging. It is tough, and COVID didn't make it any easier. And probably about 15 years ago, I was slamming against the ceiling of how many hours there are in a day and how much more I had to work, how much harder I had to work, and how much time I had in my life, because we all have the same 24 hours in each day. And I started stretching. I started getting uncomfortable. I started exposing myself to people outside of my comfort zone. And I started learning and continued learning, which I continue to this day. I think in medicine, we get a mindset where we are alone on our own, doing everything by ourselves to become the expert and avoiding all risk and all discomfort before we take any action. And that eventually gets us to be an expert at what we do, but can also keep us stuck where we are and prevent us from making a change. And I've journaled and had a lot of introspection and a lot of crises and pain along my journey, and started collecting things that changed my life and changed who I am. And after a year of coaching last year, I decided I wanted to share what I've learned to help other people. I wanted change. I didn't know what I needed, but I knew I didn't want to keep living the same day, week, and year for the rest of my life. So I discovered the hard way that what I really needed to change was me, and learned a lot of baby steps that I share every week in Breaking Out of the Medical Mindset, and dive deep over 30 different modules in the course, spanning from really a deep dive into who you are, and going through, I call it the magnet and mirror of all different aspects of your life, and remembering to dream again, to setting up goals and vision, and expanding your identity beyond what you do, to make different choices than you do in the past, to learn a different way, to do the opposite of what we do in medicine, or how you live now, to give you a different life in the future.
Amazing, amazing. I was just, ladies and gentlemen, if you're watching live, comment live, watching on a replay, comment replay, because it's very important that you write things down too. I'm writing things down by Dr. Brett here, and I like what he said here. I like what he said here. He had to change me. You have to change yourself first, ladies and gentlemen. His podcast and his show and his website is called Boom Mindset, but the boom means breaking out of that medical mindset. In order for you to find your alternative career, in order for you to find and get out of that mindset, you got to change me first. Not me, okay? You got to change you first, ladies and gentlemen. Only you can find your alternative career. Only you can get out of that comfort zone. Not your profession. Don't expect your for us, Dr. Brett, it's medical APTA, American Physical Therapy Association. Obviously, for you, it's not American Medical Association that will bring you out. Not even the government. Not even Medicare. Only you can change you, ladies and gentlemen. So I love that, Dr. Brett. You mentioned about the word getting out of that comfort zone, Dr. Brett. In your own, not medical opinion, right? In your own coaching opinion, how can one, get out of this, comfort zone? Is there any tips that you recommend or something like that?
Yes, absolutely. I think I learned to push myself into and through discomfort by asking myself, what is the alternative? And the alternative is more of the same. I've learned that I can think of discomfort as fear and the unknown, or I can think of the discomfort as possibility, as something exciting. And that's really how I look at discomfort, in a different way, to see what's on the other side of it, and decide how uncomfortable I am willing to get in order to get what I want. So once you practice it with baby steps, with doing small things, then you do bigger things, and you do bigger things. And you can push yourself into areas of discomfort with having people around you that have already done it, or that make it easier, or that give you support, guidance, and knowledge. So that's another way I think you can push yourself into discomfort. It's a great question. And it's something that none of us like to do. We would all rather do the same thing and be comfortable and know where we're going. But that is always going to take you where you have been and keep you in the same place.
That is so true. That is so true. I like what he said, ladies and gentlemen. He said here, what is the alternative? And that's our show, right? Alternative career show. What is the alternative? And I like here, there's two things here. He said, the fear of unknown and the fear of possibilities, ladies and gentlemen. If you really want to find your next level, get to your next level, whether it's in your career, being a physician, a therapist, a nurse, or whatever, whoever you're watching right now, there are always two things: the fear of unknown, like what he said, and the fear of possibilities, the fear of failure and the fear of success, ladies and gentlemen. What is it that you're fearing? Are you fearing because you're going to fail? Or you're feeling because of that expectation of being successful and you don't know what to do when you're already successful. So this is so good. And also like what he said here, baby steps. It doesn't have to be big, ladies and gentlemen. It doesn't have to be big. One baby step that you can do right now is go to his website, boommindset.com. That's a small step. So easy. Go to his website, boommindset.com. Subscribe to his website, subscribe to his newsletter. I wish I could do those newsletters too, Doc. But that's a small step right now. And then get to know Dr. Brett. Get to know him. Dr. Brett, I'm going to ask you this, right? Oh, I'm in the group, the alternative career group. We got that YouTube thing where I'm mentoring therapists, physical, occupational, speech therapist. Do you as a physician, do you have lots of physicians getting burnout too?
So I would say the rate is probably about 50% currently. I think there's been a lot of forces that have affected medicine in a negative way. Rates are going down. There's a healthcare worker shortage. Debt is going up, and all of these things. And there's a lot more technology. There's a lot more employment as opposed to entrepreneurial working for yourself. And then add COVID to it. There's sort of a perfect storm. And many, many people in healthcare are exhausted and tired and not feeling like the reward is worth the risk anymore. So, absolutely.
So physician themselves, huh?
Yes.
So we got some therapists that wants, hey, I want to go back to school, be a physician, be a PA, go back and be a nurse practitioner. And I've interviewed several nurse practitioners and PAs too, and they're also burned out. And what more for you guys who do all the paperwork for this provider? So, gosh.
I love medicine, and I still see 100 patients a week. I operate every week, but I've made choices that have made it better. And one of the surprising choices I've made is expanding my life outside of medicine and not making it my entire identity and everything I do all day long. And as I expand who I am and what I do, I enjoy medicine more because I'm less suffocated, I'm less dependent on it, and my life is richer from all the other things I do. So that was a secret. It's one of my posts in Boom. It's a surprise too. It's counterintuitive. I've found that these crises that we're going through, the misery, the dread, the burnout, has a purpose. And for me, every crisis I've had has had a purpose because pain has a purpose. And if it doesn't hurt that bad, we would stay the same. We would do more of the same. And doing more of the same and hoping and praying that something will change is the definition of insanity. I didn't know it at the time. I understood now that burnout and dissatisfaction and depletion and exhaustion, that is a radical awakening for change. And sometimes the pain just has to get worse to make you want to change. But in the end, I think when you look back, you're glad that you did change, and it opens up the possibility for so much more in your life.
That is so powerful, Dr. Brett. That is so powerful. I like what he said here, ladies and gentlemen. You have to learn how to choose. You got the choice, ladies and gentlemen. A lot of us in our group, we're talking about, I want to quit, I want to quit, I want to quit. Well, we're not, most of us in our group, we're not on a work visa. I used to be in a work visa. I just can't quit. And, because I was on a work visa, right? But most of inside our group are United States citizen. And I'm like, I want to quit, Michael. I want to quit, Dr. Mike, because I'm so, I'm burned out. But you have the choice, ladies and gentlemen. You have the choice to move on forward. Just taking that action, maybe from full time going down to PRN or part time, and then changing that setting from the nursing home, go to an outpatient setting or go to the hospital setting, and that will help change it. And I like what doctor said here. He said, I have to go out and get out of that medical mindset, and he's venturing into real estate because like what I'm doing. If I do therapy whole day, the whole week, I go crazy. And you know what I do? I do this. I do podcasts. I do videos like this. And of course, sometimes it's related to therapy, but most of the time I interview people outside of my therapy realm. I would interview, physicians, nurse practitioners, even real estate people. I would interview them because I just want to get out of that same medical mindset. And that's what Dr. Brett is teaching us. And I also like what he said here. In the middle of crisis lies an opportunity. Those pain, those, challenges that we're encountering, there's a purpose. This COVID that we're going through right now, there's always a purpose for it. And I don't know what the purpose is for your life, but you just have to find it. And this is where Dr. Brett comes in. He's going to teach you how to break out of that medical mindset. Dr. Brett, where can they reach you? Where can they find you? And then what are the different classes? Do you teach a live course or like a recording, or how can they reach you, sir?
So if you go to my website, boommindset.com, that's BOOMMINDSET.com, there's a free newsletter. Every Monday, it's a new newsletter. And then on Friday, I usually either respond to my audience questions. I share a podcast I'm on, like this one. I will share a great podcast or blog or article that I read that speaks to the platform, because my platform is all about change. One of the principles of my platform is, if I want to change my life, I must change my mind. And that means I have to make different decisions. I have to think a different way. I must change, not the system, not my boss, not my job, me. And I have gone through a lot to figure what that means out. And on the platform, on the website, there I offer a course which goes through many different areas of change. Talks about gratitude and celebrating wins. Talks about learning how to say no to wait for your hell yes. It talks about discovering that you are more than what you do. It goes into some financials and talks about the tax quadrants and horizontal income and velocity of money. It talks about the importance of leverage. I think one of the principles I discuss about medical mindset is, in medicine or in healthcare, in most professions in medicine, we compete and learn alone and on our own until we're an expert and have no questions, and then we move. But really, that is perfect for medicine, but not necessarily perfect outside of medicine. You can make a mistake and learn from it and move on. Perfection is the enemy of progress. And I have learned I don't need to be perfect outside of care for my patients. I can take a step, learn from it, move on. Fail can stand for first attempt in learning, as opposed to being a weakness and to be avoided, which is the medical mindset.
Wow, that is so powerful there, Dr. Brett. That was like value bombs there, ladies and gentlemen. Perfection is the what, sir? Perfection is the
enemy of progress.
The enemy of progress. Sometimes in life, we wait for that perfect timing. It's not gonna come, ladies and gentlemen. It's not gonna come. If I waited for me to have perfect English, I got so much haters, Dr. Brett. I got all these haters, people commenting on their or whatever, Facebook, YouTube, telling me, hey, if you can't speak perfect English, go back to the Philippines, blah, 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 blah. I'm like, if I waited for that perfect time, way for me to speak English, I wouldn't be able to inspire, empower, and encourage people. So it doesn't have to be perfect. Yes, in medicine, you have to achieve, especially in surgery with Dr. Brett, you have to achieve perfection there. But
Absolutely.
What we're talking about is the mindset of achieving your next level in life, finding that alternative career, getting out of that medical mindset, because that's where we get stuck, the analysis paralysis. So this is where Dr. Brett comes in. go to his website, reach out to him, and everything like that. Okay, Dr. Brett. I know you're a very busy person. You're seeing 100 patients a week. I don't even see 100 patients a week. Oh gosh, I see like one or two a day. So, but uh, where what you call this? What is the biggest challenge right now that you're encountering as a surgeon, as a coach, as a consultant? What is the biggest challenge that you're encountering, and how do you turn this around, sir?
I mean, definitely, I see, uh, being a physician for so many decades, more anxiety and fear than I've ever seen in my life. And I try to bring people back to gratitude and bring my patients and myself back to what is real, what is here, what is now, and focus on where I want to go, not what I'm afraid of. Focus on the future me and who I want to be, and I try to share that mentality with my patients and with people in my mastermind group and with people on my platform. My goal is to help people, whether it's my patients, whether it's my subscribers, discover happier, more empowered lives, and to teach them what has worked for me to help me make a change.
Oh wow. Oh, that is so powerful, Dr. Brett. Appreciate that. So you're correct. So you're so correct, sir. There is so much anxiety out there now. Obviously, you're in this, surgery field, ENT, even in therapy, sir. I've encountered we're basically called geriatric physical therapy. We deal with geriatrics. There was a time when we were treating geriatrics, they were like, okay, we're all gung-ho and everything. Now even our geriatric population, who you would think that they're all set up and everything, they have so much anxiety now too, and especially the younger ones, the generation that are retiring. There's so much anxiety too, and of course the younger ones too. So you are correct, sir, and this is where you come in and change people's lives, improve their lives and empower and equip them. So again, thank you very much, Dr. Pratt. Appreciate you again. Could you please tell us where they can reach you and find you, sir?
www.boom, BOOM, mindset, mindset.com, or breakingoutofthemedicalmindset.com. Subscribe to our free newsletter. Check out the course. I think you'll find it's very, very valuable, informative. I recommend books. There is a playbook of 70 pages of exercises and questions to answer and different ways to evaluate your life and to make change.
Perfect, perfect. Again, thank you very much, Dr. Brett. I appreciate you for your time and for coming over our show. But before I let you go, ladies and gentlemen, always remember the word fast, F-A-S-T, letter F. Find friends that will bring out the best in you, because you are the average of the 5 people you hang out with. So today I hang out with Dr. Brett, and I feel like, I'm changing my mindset now. Boom mindset. Who would have thought about that? I should have done that, right? Boom mindset. Gosh, breaking out of that medical mindset. So find friends that will bring out the best in you. Join this mastermind class. Connect with him. This is his website, boommindset.com/course. Okay, that's letter F. You know what's next letter on the word fast is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not going to do Dr. Brett good if you don't take action, guys. Take action. Like what he said. What's that? Perfection is the enemy of progress. All right. Stop the analysis paralysis and just take action. Go to his website, subscribe to his newsletter. That's the first step. All right. Doesn't have to be perfect. Imperfect action beats perfect in action, ladies and gentlemen. Take action. All right. Just like the show, there's this show called the movie, the director says lights, camera, action. You can have the camera ready, you can have the lights ready, but if you yourself don't take action, it's not going to do you good. The show will not roll if you don't take action. You have to take action, okay? You know what's the next letter of the word fast is letter S, is share. Share and subscribe. Go to Dr. Brett's website, share that, share his do you have a Facebook page, Dr. Brett, or
Not yet.
not yet? Okay. So see, but the website, share the website. It may not be applicable to you, but it could be applicable to someone else. Okay. It's sharing is caring. Sounds cheesy, right? But like what I say, it may not be applicable to you, but it could be applicable to someone else. You may know a physician or a nurse practitioner or a PA who is already burned out, who needs guidance from an expert like Dr. Brett, right? Of course, I can't mentor a physician. Well, I mean, I can
You
probably, but
probably could.
but you know, why would the physician listen to me? I'm a physical therapist, so I would mentor a physical therapist. And same thing with Dr. Brett. So share it to your friends. I'm sure you know a physician or a PA or a nurse practitioner who is quote unquote kind of burned out in the profession and wants to change a little bit. Reach out, share his website. Okay. And last but not the least, on the word fast is letter T. Is teach it. Teach it, right? Teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. And this is what Dr. Brett is doing. He's teaching therapists, teaching physicians how to break out of that medical mindset. Go to his website, boommindset.com. Appreciate you, Dr. Brett. And last parting wisdom, Dr. Brett.
No, this has been a great experience. Very fun. You're very good at what you do. And that is how you fuel your bucket. That's how you fill yourself up to give more with your patients. So
There you go.
you are living and mentoring and showing what everyone needs to do. Is find what you love and do it and let it overflow into other areas of your life.
Amen. Amen. It has to come from the leader themselves. So you're doing a great job too, Dr. Brett. Appreciate you. Again, be awesome, be great, be excellent. My Facebook, YouTube, and friends out there. Again, thank you very much, Dr. Brett. Appreciate you. But of course, before we close, I gotta show this video. I'll see you around, my Facebook friends.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the